Next session is on Challenges of Pharmacovigilance in Ayurveda by Dr. Prajishnath Ian. Dr. Prajishnath Ian currently serves as Assistant Professor in the Department of Rasashastra and Baishya Kalpana and also working as Program Coordinator of Peripheral Pharmacovigilance Center in Amrita School of Ayurveda under the Ministry of Ayush. National Pharmacovigilance Center, All India Institute of Ayurveda, New Delhi, honored him as Best Peripheral Pharmacovigilance Center Coordinator during the academic year 2020 to 21. With great respect, I welcome Dr. Prajesh Ian to please take over the session.
My humble pranams to Amma. I know I'm not taking not much time, more than only 5 minutes. I'm only going to the content of the slide. We know that we discuss what is pharmacovigilance, where to report, how to report, when to report, whom to report. This all discussed by previous speakers. I want to discuss only the challenges of the introducing PV, that is pharmacovigilance in Ayurveda. There is so many challenges are there. I am trying to point out only some challenges. The first challenge is under-reporting of ADRs. Since 2020, I was the coordinator. I am coordinator of PPVC Amrita. So till now we have only hardly 30-35 ADRs till now. This is all main concern is under-reporting. The reason for under-reporting of ADRs among the Ayurveda community, they are saying that lack of time. First is lack of time. They didn't have time to report. They have to fill the ADR form. And they have to send the ADR form to the PPVC, that Peripheral Pharmacovigilance Center, etc. But now it is simplified. We from the Ministry of Ayush, NPVC, that National Pharmacovigilance, started a site and also so many centers, more than till now it is 99 centers all over India. So in Kerala there is 2 centers are there for northern side, northern 7 district, from Kottakkal, southern 7 district, is looking by the Amrita School of Ayurveda. It's easy to approach. There is no reason that there is no way to say that we don't have time during practice like that. Then next point is IMA targeting. After reporting a ADR to a PPVC, the physician thinks that I may target. Because there is no question arise in that I may target in reporting ADRs. Because it is full confidentially we will keep. We will not share any details, any patient details to anyone. This directly we will send to the IPVC, that is Intermediate Center. Then we will send to the in a national center, that is Delhi. Next challenge is that is Ayurveda curriculum. That somewhat it is solved, but new syllabus revision. They added so many points in the points of the pharmacovigilance, pharmacovigilance program, pharmacovigilance, how to report, where to report. This all added in the new curriculum. Then next is drug safety problems. And that already discussed. Ramana sir also discussed. Khalif sir also discussed methods. That is, we don't have standard protocol study to the toxicity studies. This already we discussed. Then next is multi-ingredient Ayurvedic medicines. One of the main challenges in Ayurveda, there is Ayurveda. We are using polyherbal formulations. It contains so many ingredients. We are not able to find which causes. Simultaneously, we use for a jora. If a patient comes, he will amrutottam kashayam, amrdarishtam, vettumaran gulika. We are not able to point out which drug causes ADR, which ingredient which causes ADR, like that. Sometimes if we take the vettumaran gulika tingling sensation because of aconite, this is because of Vatsanaba. That is we know that. But in some extent we are not able to point out which one cause, which ingredient, which formulation causes the ADR. Next is inherent belief that already these already discussed. Inherent belief that Ayurveda medicine is safe. From my experience from the ADA reporting, we are facing so many reactions happen. So no Ayurveda medicines, no medicine system is absolutely safe. Next is then next patients use so many system of medicines at a time. If some patients using the diabetes, the diabetic medicines or hypertensive medicines, etc. Then they will come to us. Then we will prescribe some medicines, Ayurveda medicines. So there will be chance of drug interactions. Next is lack of quality assurance and control. So I think we all watched the film that Skinneri Puriyoran that is released in 1994. In that movie, that Jagadi is using Jalusadi Lekyam. That I think you may know that Jalusadi Lekyam, Krosnadi Vadagam. Now it is that has happened because recently that news came that some Ayurveda medicines released from the Northern Pharmacy, that coming from the Northern Pharmacy, North India, they have the content of the paracetamol or that paracetamol and the diclofenac. This is the that we have that it's our duty to conduct the standard protocol and conduct the toxic study, and also the right methods to right quality assurance and the control in the manufacturing unit. Then hair drug is already discussed. Then limited research evidence. It's all already we discussed. Next, what happens if we didn't report the ADAs? So if we Ayurveda community as a Ayurveda doctors, if we didn't report the ADAs, in the other communities as modern medicine people will report, like A.B. Philip, like that, no, Dr. A.B. Philip, that they will report. This all, I want to show some of the studies. These all reported by non-Ayurveda physicians. So if we didn't conscious about the reporting of ADAs, and if we didn't develop the culture of reporting ADAs, the other the modern doctors will do that now. They will report in the many quality journals like Scopus, like that, in the international journals. They will have the wide visibility more than us. So it's our duty to find ADAs and and also report ADAs to nearest centers, pharmacovigilance centers, and also develop a reporting culture. That is our duty. If we didn't do that, others will do that. And also what we can next, this also we will discuss. iSuraksha portal is there where you can report as a doctor. You can report in that directly. ADR sample ADR form we are kept in your seminar kit. We developed that is a simplified ADR form we developed in Amartha School of Ayurveda by the guidance of NPPS, that is National Pharmacovigilance Center. That is simplified ADR form. Then you can adopt in your college, in your clinics, like that, and also you can send that to the nearest center. So I want to conclude that what all we can report. All the ADAs, all the drug reactions, adverse drug reactions, and also Panchakarma Vyabhats, Panchakarma, that errors, everything you can report. Everything you have to report and develop a reporting culturing of ADR. Thank you.
Thank you, Dr. Prajesh sir, for your insightful session on the challenges of pharmacovigilance. We welcome Dr. Priya ma'am to felicitate Dr. Prajesh sir. Welcome Dr. Priya S, Principal in Charge, Professor and HOD